something about how you see the benefits of myofunctional therapy for the healthcare and dentistry industry?
I think myofunctional therapy is very important in children's airway. I think a lot of children have obstruction in the oropharynx, so the base of tongue. And if you can encourage that tongue to be in its correct position and also appraise things such as tongue tie, so that the tongue can do its normal role. The tongue is a very powerful organ, and I think if you learn to train it, you're going to see a much better improvement in overall health. We teach our children how to talk. We teach our children how to walk. We've got to teach our children how to breathe through their nose and how to keep their lips together and their tongue on the palate. And many people think that's a taken, and if you look at a newborn baby, it is. But for some reason, by age 2 and 3, children tend to adopt a open mouth posture. And what we need to do if we want to improve that situation is educate parents, number one, and also other allied healthcare professionals on the importance of good lip seal, of good nasal breathing, and of good tongue posture. And they all go hand in hand. And what we've seen from our CBCT studies is that when the tongue is in its proper position, it forms a very good seal with the soft palate, and that opens up the velopharynx so that that child has a very good patent airway. So I think, yes, many people understand the role of the tongue when it comes to speech and articulation, but I think more and more they understand the role of the tongue in a good or a bad way as far as breathing and as far as development of the palate. Where I come in as an orthodontist is I see all the kids who have poor tongue posture and have very narrow palates, because the role of the tongue is really to stop the buccinator muscles from constricting the palate. So if you have your tongue in the right position, it effectively is maintaining a good arch form, and you end up with less need for orthodontic treatment as the child gets older.
And how do you think we can promote an understanding of the benefits of not just myofunctional therapy, because that becomes the treatment, but of good tongue and mouth posture in the general public? How might we promote that?
I think the general public needs to first realise what is wrong with mouth breathing on a continual basis. Many people think mouth breathing is normal. I always say to parents, if you think breathing through your mouth is normal, would you be worried if your child starts to eat through their nose? I'm sure you would be. And then I show them all the studies, both done on animals and on humans, that shows an adverse facial profile with continual open mouth posture and lower tongue position. So I think if it's not from facial aesthetics, if it's not from a good sleep cycle, if it's not from preventing orthodontic treatment, and particularly the older form of treatment which involves extraction of teeth rather than development of the palate. But I think it's at smaller levels where we go out to schools and we talk to the teachers, we talk to the primary healthcare providers, and we make them understand how important this field is. And of course, we now have a lot of very good evidence-based research that supports exactly what we're doing. And I think there's many people that are trained well in this field, but are finding it hard to convince some of their patients and some of their referring colleagues of where they fit in the importance of the scheme. And I think that's where my research comes in, which clearly shows that without myofunctional therapy, the results are not as good.
And finally, what about the traditional orthodontists who are concerned about what effect myofunctional therapy will have on their own practice, which will include all sorts of other interventions?
Well, I think everyone is used to being in a position where they're comfortable and they're doing the same thing maybe they were doing for years and years. But I think you've got to look outside the box. I mean, when I incorporated myofunctional therapy into my office, I had to make a lot of changes, and that took some time. And many of my staff were resistant to that because, of course, like anything, they just want to take the normal approach. But now that they've seen the real benefits, and really we're getting so many referrals from like-minded individuals because they know what we do is more holistically based and much better for the patient. So I think for any orthodontist who's worried, take some courses, read the research, and understand this is an important part of the therapy you're providing patients. Every orthodontist in the world that I know wants to do the best for their patients, but maybe they've been advised during the undergraduate years that things like myofunctional therapy really don't have any evidence base, and it's all hocus pocus and it's all black magic. But I think, we're talking about years ago. If we now look at the research, and I'd like you to particularly look at the research by Christian Gumenew from Stanford University. And one of the things that he has really come up with is the importance of myofunctional therapy in the treatment of obstructive sleep apnea in children.
Thank you very much, Dr. Derek.
Okay, my pleasure.
This has been very helpful and very informative.
And good luck for the future success of your society. Hope maybe to one day come back and give a lecture at one of your symposiums.